Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Are intramural fibroids normal? Intramural fibroids are the most common kind of uterine fibroid. These non-cancerous growths grow in the muscular wall of the uterus, womb. They are typically found during a routine pelvic exam and often diagnosed between ages 30 and 40, though they can develop at any age. /r/n/r/n Intramural fibroids are usually harmless and do not always cause symptoms. Sometimes, however, they can be problematic and cause heavy periods, spotting between periods, lower back pain, and painful intercourse. Intramural fibroids can also sometimes cause reproductive challenges. /r/n/r/n This article discusses intramural fibroids types and possible symptoms. It also explains what causes intramural fibroids and how to treat them. /r/n/r/n Illustration by Zoe Hansen for Verywell Health. /r/n/r/n All intramural fibroids grow in the walls of the uterus, between the fibers of this muscle. Intramural fibroids are classified based on where in particular they grow. /r/n/r/n Where a fibroid appears can determine the impact it has on your health, and inform treatment options. For example, a large intramural fibroid at the bottom of the uterus could impact vaginal childbirth. /r/n/r/n Many people with intramural fibroids and other types of uterine fibroids have no symptoms. About 70% of women have fibroids before they reach menopause. However, only 20% to 50% of those have symptoms that require treatment. /r/n/r/n The symptoms of intramural fibroids include /r/n/r/n Verywell, Jessica Olahrnrn Researchers aren't yet sure what causes intramural fibroids. There seems to be a genetic component, but it's not well understood. The growth of fibroids seems to be linked to the hormones estrogen and progesterone, and fibroids often shrink after menopause when the levels of these hormones drop. /r/n/r/n Black women are more likely than other women to experience uterine fibroids, although researchers aren't sure why. /r/n/r/n Intramural fibroids can also cause reproductive problems. Whether or not a fibroid impacts fertility depends on various things such as its size and location. /r/n/r/n Some intramural fibroids can block the fallopian tubes, making it very difficult to get pregnant. Very large fibroids can make it difficult for a fertilized egg to implant in the uterus. /r/n/r/n If you are planning to get pregnant, your healthcare provider may recommend removing intramural fibroids. Ask your healthcare provider how long you should wait after the procedure before attempting to get pregnant. Depending on your specific situation, you may be advised to wait 3 to 6 months or as long as 12 months. /r/n/r/n Oftentimes, intramural fibroids are detected during a routine gynecological exam or an ultrasound that is done for other reasons. /r/n/r/n If you have symptoms like heavy periods, your healthcare provider might perform a physical examination of your uterus. To do this, they'll press on your abdomen while inserting 2 fingers into your vagina. Sometimes, providers can feel fibroids during this process. /r/n/r/n If they can't feel any fibroids, they may order additional screenings, including an ultrasound, MRI, or CT scan. The images produced during these procedures will help determine the location and size of fibroids. /r/n/r/n Many people who have uterine fibroids do not need treatment. Fibroids are non-cancerous, and if they're not causing symptoms, there is no need to treat them. However, if they're causing you pain, heavy periods, or infertility, talk to your healthcare provider about treatment for fibroids. /r/n/r/n if you want to be able to have children in the future, talk to your healthcare provider about treatments that preserve fertility. /r/n/r/n Some treatments focus on controlling the symptoms of fibroids. This can include going on hormonal birth control to alleviate heavy or painful periods. /r/n/r/n People who are still having symptoms might be steered toward non-surgical procedures, including /r/n/r/n GnRH agonists are medications that put your body into a state that is similar to menopause. This can cause your fibroids to become smaller, though the effects only last for as long as you take the medication. /r/n/r/n GnRH agonists can have side effects such as /r/n/r/n Some side effects can be serious, including /r/n/r/n For these reasons, GnRH agonists are usually only used in the short term. They are often given prior to surgery to help reduce the length of the procedure and the hospital stay. /r/n/r/n Certain lifestyle adjustments may help. Reducing stress, maintaining a healthy weight, and limiting red meat can help keep fibroids at bay. /r/n/r/n Large or numerous intramural fibroids can be difficult to treat with non-surgical options, but small ones or having just a few can be much easier to treat with medications. Because of that, surgery is the best option for some patients. /r/n/r/n One procedure is a myomectomy. This surgery, which can be done laparoscopically, via a small incision, or with a full incision, removes fibroids while keeping the uterus intact. It's meant to be an alternative to a hysterectomy, which removes the uterus. A hysterectomy is another treatment for fibroids. /r/n/r/n The decision on whether to remove a fibroid depends on various factors, including whether or not they are causing symptoms and if they might cause fertility problems. /r/n/r/n Not all studies agree on the size that warrants removal. Some suggest that intramural fibroids should be removed if they are larger than 2 cm in diameter, though healthcare providers may not recommend removing them unless they are more than 7 cm. /r/n/r/n If you plan to become pregnant, talk to your healthcare provider about what's best for your situation. /r/n/r/n People with uterine fibroids have a good prognosis. Overall, intramural fibroids are not dangerous, but the why can cause unpleasant symptoms like pain, heavy periods, and trouble getting or staying pregnant. Talk with your healthcare provider about which of the many available treatment options is best for you. /r/n/r/n Intramural fibroids are non-cancerous growths within the walls of the uterus. These fibroids are often harmless but can cause symptoms including heavy periods or trouble conceiving. /r/n/r/n If you don't have symptoms, intramural fibroids don't require treatment, just monitoring. However, if you have symptoms, there are treatments available, ranging from birth control to lighten your periods to the surgical removal of the fibroids. /r/n/r/n Intramural fibroids can be very large. A large fibroid is one that is 10 cm or more in diameter. However, even smaller fibroids that are about 4 cm in diameter can cause complications, like blocking the fallopian tubes or interfering with delivery. The size of the fibroid is not necessarily tied to the severity of symptoms. /r/n/r/n Calcified fibroid is one that has died or degenerated. This usually happens after menopause when hormonal changes cause fibroids to lose blood flow, causing the cells in the fibroid to die, then calcify. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.